I don't think I'll need that time, but anyway, I want to thank Deputy Brazel for bringing forward this bill. Deputy Brazel and I are members of the Health Committee, and we've had occasion to hear many presentations and hearings on the issue of access to orphan medicines. We've also been approached, as I think has probably every person in this House, by patients, by their families and by clinicians on this very issue. Over the last number of years, it has become increasingly apparent that when it comes to approving drugs for rare diseases, the system is simply not fit for purpose. This bill, while it is not the panacea for every issue surrounding access to orphan drugs and the approval process, does go some way towards addressing a fundamental problem. It allows for the establishment of a specific criteria applicable for orphan medicinal products for the purposes of the Health Service Executive making a relevant decision regarding adding an item to the reimbursement list. The HSE estimates that 300,000 people in the state will develop a rare disease at some stage in their life. There are between 6,000 and 8,000 known rare diseases, but just 5% of these have a licensed treatment option, and there is a high level of unmet need. And it is that unmet need that we meet at the gates of this institution when we're coming in and out. It is that unmet need that causes people to have to get up out of their sick bed or on behalf of their children to come and protest outside of the Dáil. It is that very same unmet need that has to be addressed. It puts pressure, unfair pressure actually, I will have to say sometimes, on members of government. But people feel that they have no option, and the pressure mounts, the pressure comes on us, and then all of a sudden you're standing here and someone's standing up waving a piece of paper saying, well, what price of life, Minister? That's no way to do business. That's no way for sick people to have to behave. But they're not doing that because that's their first option. They're doing that because they feel that they have been left out of the process. They feel that there is something, and which of us wouldn't do that? You know, if it was your child or your loved one, someone in your family, your neighbour, which of us wouldn't do it? You know, of course we would if you think that there's an option. But every time we see a protest out there, it is evidence that the system for assessment is really just not fit for purpose. The metrics used by the Health Service Executive to evaluate the effectiveness and approve orphan drugs are unfit for purpose. They don't take into account the distinct differences between drugs for rare diseases and drugs for non-rare diseases. Therefore, we see it as imperative that the HSE changes the way it evaluates medicines to treat these very rare conditions. We believe that when it comes to the approval of orphan drugs, the process needs to be more transparent, as well as giving patient groups and clinicians a stronger voice in the National Centre for Pharmacoeconomics and the HSE decision-making process. We are also aware that the pricing strategy adopted by some pharmaceutical companies in recent years presents significant challenges, and this is leading to serious affordability problems for the health service in Ireland and internationally, and it's exactly that I was referring to. It's that pricing strategy that is adopted by some of the pharmaceutical companies that puts pressure on the campaign groups, who in turn put pressure on politicians, who in turn find ourselves standing here waving at the Minister saying, what price of life? That's no way for this to be run. But none of us want to be in that position, absolutely none of us, and that's why I do welcome this legislation, and I would urge the Minister and his colleagues to reconsider support for this, and I'm sure Deputy Brazel will be open to working with them if the belief is that amendments are needed. But we've all acknowledged that a change is needed, and I think that's what we should be working for. The National Rare Disease Plan, the generic policy framework for rare diseases compiled by the Department of Health, recommended the bringing forward of appropriate decision criteria for the reimbursement of orphan rare medicines and technologies. However, to date, no dedicated decision-making criteria has been forthcoming. Instead, orphan drugs have to be assessed in this narrow confine where matters of cost almost immediately rule out their approval for any patient. The HSE has traditionally been an early adopter of new medicines where clear evidence of clinical benefits to patients can be demonstrated and value for money assured. This remains the case when it comes to non-orphan drugs. However, when it comes to approval and adoption of new orphan medicines for rare diseases, it is failing. Again, it is important that this legislation seeks to establish a new set of criteria for consideration of orphan medicinal products, mitigating against low qualitative data and guaranteeing that the HSE will consider qualitative data presenting on an orphan medicinal product for patients, clinicians and others. We are all aware that a fundamental problem with the current approval process is that there are no dedicated criteria for the approval of orphan drugs. Unfortunately, unlike many other health systems across Europe, there are no specific protocols and processes to evaluate orphan medicines, meaning that orphan medicines are assessed under the same methodology intended to be applicable to all other medicines. Essentially, a drug that treats a patient with muscular dystrophy is appraised using the same cost-effectiveness process that is used to assess and approve an aspirin to treat headaches. We agree with experts, including the Irish Pharmaceutical Healthcare Association, that the quality system and the threshold are fair in assessing the value for money of innovative, non-rare disease medicines brought forward by companies, but not for rare disease medicines. Furthermore, the current decisions regarding the cost-effectiveness of a new drug for a rare disease do not take into account the wide-ranging savings that could be made from a drug's approval. For instance, it doesn't factor in savings from a patient not needing to return to hospital or require a more expensive treatment down the line, or indeed time taken off work or time committed by a family carer. We need to change the way we evaluate medicines to treat very rare conditions. As well as the passing of this bill, we also need to see a new assessment system and approval process which guarantees input from patients and clinicians and gives them a stronger voice in the HSE decision-making. Such a system works extremely well in Scotland, where they have a patient and clinician engagement assessment process. If we had such a process here, it would give patient groups and clinicians a stronger voice in the HSE decision-making and the assessment process. It would also allow the HSE to gather detailed information which would allow a discussion on the benefits of a medicine, including how it can impact on the quality of a patient's life. This information is not currently captured within the present assessment process, and is why patient groups tell us that they feel left out of the decision-making process. And as I said, that manifests itself at the gates. That's where that ends up, because people do not feel that they have been part of the process. They feel that they have been shut down, that the answer was no before anyone ever looked at the assessment, and more importantly, that nobody is taking their child, their loved one, their person that they are representing into account. And I'm not suggesting that that's how it is. I'm telling you that that's how they feel. And that's how they end up outside, because they feel that they are locked out of the process, or that the process is not fit and can't adapt to assess properly what the needs are for their loved one. The drug approval process I've referred to works incredibly well in Scotland, and it ensures that all those who are affected by such decisions, such as approval for reimbursement, feel that their opinion and evidence have been heard, most especially the patients. The current situation we have regarding orphan medicines is not working. That is clear, and that is why Deputy Brazel has brought forward this bill, and that's why I believe there will be cross-party support for it. Again, I commend this bill. Sinn Féin will be supporting it, and we hope that it is the start of a significant movement on this issue. And we have all listed off the cases. We know the names of the drugs. We know the first names of usually of the people who are campaigning, because we meet them. But we shouldn't have to meet them, and they shouldn't have to feel that they have to come up here. And the truth is that the pressure that they apply very often works. They can, when they get the initial no, sometimes when sufficient pressure is applied, it works. And that shouldn't be the criteria. It shouldn't be the case that the sickest people who travel the furthest, who stand out there the longest, are the ones who can get the medicines. It has to be the case that there is a process that is fit for purpose, that doesn't always give every person exactly what it is that they believe, that is based on clinical evidence, and that involves those patients. And so I would urge you, Minister, to reconsider and indeed to join with us, with Sinn Féin and with the other parties, in ensuring that this legislation is passed. Oh my God.